Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to your Direct Connection. We begin tonight with a new safety effort on one of the state's most dangerous highways. The Jones Falls Expressway, the site of near daily crashes, is getting speed cameras. Joining us to answer your questions tonight are Delegate Tony Bridges of Baltimore and Marley Cardona-Mose, Chief of Communications for the Baltimore City Department of Transportation. Thank you so much for joining us. Delegate, I'll start with you. The idea of traffic cameras, speed cameras, people are getting used to it. But, you know, I haven't seen any on major highways like 95 or the Beltway outside of maybe work zones. Is this something new?
Well, first of all, thanks for having us on. For me, this is really something that was very much needed. And so when the mayor actually said that he wanted to put this legislation in, I was more than happy to be the person that sponsored the legislation on the city's behalf. Yes, this is something that's pretty new in the city of Baltimore. At the state level, we don't normally have speed cameras unless they're in work zones. And so for us to have speed cameras identified for a particular interstate had to go through state legislation. And so it was important enough for the city to want to put in the legislation. And just based on what you said alone, when you started off the conversation talking about the daily number of accidents that you see on 83, I thought it was important to put it in as well.
And Ms. Cardona-Mose, I read that in the testing of the new camera system or prior testing, you came up with some unbelievable numbers for how fast people drive sometimes on this very windy highway.
Oh, yeah. I mean, a tagline of the campaign is, it's not the Grand Prix, it's I-83. And you wouldn't know that the way that people speed down that interstate. So, you know, the cameras are uniquely and specifically positioned at some of the areas that are riskier at higher speeds. And that's the reason that the placements are where they are on the interstate.
But you clocked people doing 150, 175?
We had 173 as the highest recorded mileage. And I want to tell the public that is not a challenge. That is a very, very dangerous speed, almost unimaginable. But we clocked that at around 12:35 in the morning one weekend evening.
Good grief. I would think, you know, any normal vehicle with any normal driver would just go flying off the side of that highway. From the standpoint of the city transportation department, what needs to change on the highway? What are you trying to make happen here?
Sure. So as I said, the two places where we had the speed cameras are two of the areas where we've identified as higher risk for people traveling at higher speeds, right? So one is on a curve right past 43rd Street, and the other one is northbound right before kind of a straightaway on the highway. So what we want is we want people to be speeding down all along the highway. So when they arrive at these riskier areas, they're reducing the level of harm that they can do to themselves or to other motorists on the interstate.
So it's not a secret where the camera is?
No, absolutely not. We did public notification. We have a 90-day warning period campaign where we're going to be counting down the days until people will get real live citations. And we're hoping people will take that time to modify their behavior. So Delegate, we're going to be doing all we can so that the public's aware that they need to be slowing down.
Delegate,
Jeff,
your thought on
add to that.
Go ahead.
I'm sorry. Even as you're driving along Interstate 83, you'll see posted speeding
the sentries.
Cameras. Yes. So you'll know how fast you're driving as you're going along Interstate 83. So there are all sorts of measures to get people to actually know what their speeds are and slow down while you're on the interstate.
And those speed sentries are actually about 200 meters out from where the speed cameras are. So you do have that time to realize if you're going anywhere near 12 miles over the posted speed limit, you do have time to slow down before you see that flash and it triggers a citation or a warning.
Well, that's interesting. I mean, that gets to the argument that some people make that when governments put up speed cameras, it's more about the revenue than about the speed.
I think that a lot of people understand that the absolute primary focus of the speed cameras are safety, right? If there's a fatality, if there's a crash where people are harmed, public safety is our number one priority. I also think that, residents appreciate that if you don't follow the rules, there has to be some type of consequence. So, having a funding stream that is based and being recycled back into improving the infrastructure of the city, to us really seems like a no-brainer. So we're grateful to Annapolis and to delegates like Tony who are putting forth legislation that accomplish public safety, but also renewable income streams to maintain those programs.
Delegate, let me get to you on that, but I'll remind our viewers, if you have a question about these new traffic cameras, give us a call at the number on the screen or send us an email to livequestions@mpt.org. Now, Delegate, on the debate about how much the fine is going to be, and the fine's relatively small, and whether there could be points, how did all that play out?
Well, when we started talking about this legislation, we didn't get into into the weeds of, how everything will play out with the number of points or the amount of the citations. It was more about making sure that the city had some enabling legislation so that they could actually move forward with it. And so it was really up to the city to come up with those dynamics. But here's the other thing about the legislation that was put forth and why there was such a big need for it. We keep talking about all these accidents. You know who has to respond to all those accidents? It's Baltimore City Police Department. And the reason that they have to respond to the accidents is because the state did not have anything in place for any of the state agencies to actually maintain the road and travel the road. So the state police, until this year, did not have any MOUs in place to actually travel along 83 to actually do any enforcement. And so every time an accident or something occurred on Interstate 83, it was the Baltimore City Police Department taking resources out of our neighborhoods to respond to what's happening on Interstate 83. And I'd rather have the police back in the city doing the work that they need to do rather than just responding to accidents that we have probably on a daily on Interstate 83.
And Marla, you were telling me that you do now have some state troopers at times on the JFX.
So so for the JFX and the I-83 speed cameras, those citations are automated through the speed camera system. So it's quite the opposite. We actually don't need, BPD or state police on the interstate to be able to intercept anybody who's going over the speed limit.
There's no place to pull them over anyway, right?
Yeah, and this is because it's a very narrow and winding interstate, and we wouldn't want to we wouldn't want to jeopardize the safety of BPD, state police, or anyone, because the only shoulders on I-83 are for emergency pullovers only. So these speed cameras really achieve both goals in terms of enhancing safety for local law enforcement, while also accurately capturing motorists who are violating the speed limit on 83.
I'm wondering if either of you have noticed something that I sense, I believe that drivers got crazier during the pandemic somehow. Maybe got used to there being less traffic and driving faster or taking out their frustrations in some bizarre way. Is there any way to prove that it's gotten crazier out there?
I mean, if that 173 mile an hour number doesn't do it, I'm not sure what does. But we do have data that suggests that the trends that we see on 83 are consistent with over the last 5 to 7 years. And we do have updated crash data leading all up until last week of 2022. So, the placement of the cameras, like I said, is consistent with those areas that are statistically riskier for high speeds.
Delegate, would you be in favor at some point of having maybe a sliding fine system? So I think the fine is $40, whether you're going, what's the cutoff? 12 miles over the limit. So that driver pays the same fine as the person doing, 200 miles an hour or whatever.
Yeah, for me, I'd rather not have anybody speeding first, but if they are going to get the fines, then yes, I think that maybe there should be some sort of sliding scale, and the higher the speeds are, maybe the more of a fine that you actually get. It's something that we can definitely think about and try to put in place at the statewide level as well. But I think that, first and foremost, we've got to get people to slow down. And if you've traveled 83 over the last couple of weeks, like I have, and started seeing those flashing lights as people are going through those cameras and going way too fast, you're starting to see more and more people slow down, in my opinion.
Phone call from Baltimore City. This is John. John, thank you for calling. Go ahead.
Yes, my question is, why is the grace period so long, and why are the fines so small when the problem is so difficult? I'll take my answer off the air.
Thank you, sir.
Okay.
Yeah, I can start with that. So for us, when we first started the legislation, as we were going through in our legislative process, some of the legislators actually had an issue with us just immediately going to the fines once those cameras were installed. And so as a compromise, we did go to the 90-day grace period for individuals so that we could get people stopping or slowing down and get used to the fact that as much as they were speeding and using Interstate 83 as a raceway, it's not the same thing anymore. And so we were intentional in making sure that people knew that these cameras were here. They are going to get fines, but we did want to give them a little bit of a grace period because they may not, well, actually nobody is used to getting seeing those cameras on Interstate 83 at this point. And so we wanted them to get used to slowing down, and that's why we gave them the 90-day grace period.
Email question from Bill in Baltimore. If someone is caught speeding on camera, what enforcement measures will be deployed? Basically none, except you get a ticket in the mail, right?
Mm-hmm.
That's
And
right.
how does that actually work? So you've got to capture a license plate.
Yeah, so the current technology that we have out there right now is that we have the speed cameras, we have the equipment monitoring cameras, which people will sometimes confuse for the speed cameras, but it's what we use to make sure that, through storms, harsh weather, that the cameras aren't down, that they're functioning properly. And then we have the speed sensors. So we have these 3 sets of equipment out on the interstate. And the goal is that essentially the speed cameras have the ability to accurately track 34 cars, across various lanes. So they can really pinpoint which car, even if there are 4 consecutive cars in a row, is speeding above the limit.
Marley,
really,
tell me that again, because a lot of people are suspicious of radar. And I did a story a long time ago about, radar sprays everywhere. And if your car is right here, but there's a bigger truck behind you, it's really reading the truck and not your car. How does this work?
Yeah, so the way that it works is that it's a 3D technology, and it's able across volume and density to really pinpoint where a vehicle is. And it takes a snapshot of exactly the moment when that vehicle is in violation of whatever the conditions are set, So people will be receiving in the mail, they'll be receiving their exact speed and also an image of their car. And I think to us, it's really important that this program be rolled out in a way that's transparent, where the public understands if they're getting a ticket, they're getting a ticket because they were speeding. And that's also part of why we're giving the public a 90-day warning period. We want them to modify their behavior. We want them to slow down, for themselves and for everyone else that's on the interstate. So a lot of what we'll be doing over these 90 days will be educating residents and motorists, answering questions about the technology, and really getting into the weeds, because we want and need this program to have the credibility that it deserves, because the technology is accurate and the technology is working.
Well,
and we wouldn't put it out there if it weren't.
Along the lines of modifying behavior, interesting email from a viewer who lived in England says the traffic cameras are painted a very clear yellow. Researchers found this was an effective measure to attract drivers' attention and slow them down. I mean, it reinforces the idea that you don't want these to be invisible.
Yeah, and if you drive down 83, you'll notice over a few miles, we actually have a significant amount of signage that reinforces the speed limit, that are speed sensors that tell people how quickly they're going, that say speed enforcement ahead. So, and that's across, 2 or 3 miles on either side of where the speed cameras are. And the idea is that we don't want to create an effect where people are braking before the camera. We want people to be aware that there are speed cameras in the area so that there is a...
Marley, we're going to have to leave it there. Our thanks to Marley Cardona-Mose and Delegate Bridges. We appreciate your time. Thank you so much.
Absolutely.
Uh-oh. Earlier today, we talked with a professor from the University of Maryland School of Medicine on the subject. And joining us now for Your Health segment is Dr. Rodney Taylor, professor and chair of otorhinolaryngology at the University of Maryland School of Medicine and chief of head and neck surgery at the University of Maryland Medical Center. Doctor, this is Head and Neck Cancer Awareness Month. Awareness may be limited of these areas. So help us understand what we're talking about here.
Sure, and good evening to you, Jeff. And so head and neck cancer, when we use that term, we really are describing tumors that occur in the mouth, the throat, the voice box area, even the sinuses. And historically, these are tumors and cancers specifically that people may be familiar with that may come from smoking cigarettes and drinking alcohol excessively. But that's the umbrella term, head and neck cancer, to really describe the variety of cancers that start in that anatomic area.
And these cancers are on the rise, I'm afraid to say, despite the fact that, you see fewer people smoking.
Certainly, and you make a good observation, Jeff. In fact, the smoking-related cancers of the head and neck are on the decline. The one exception is oropharyngeal cancer, and that's cancer really that's in the tonsil area and the back of the throat area. We call that oropharyngeal cancer. And the primary driver of that increased incidence is not smoking or drinking, but rather HPV virus association and infection.
Good opportunity to talk about the HPV vaccine, which is only for younger people, right?
Largely, it's certainly being touted to individuals who have not had primary HPV infection exposure. And so certainly, if you wait until later in life, many people have already been exposed. And so kind of the opportunity for down the road cancers has already happened. And so the idea is treating children and treating folks earlier in life, you would have been able to provide the vaccine before exposure happens, and that's where it's most useful.
These cancers come up tends to be older people?
Historically, the smoking and drinking related cancers happen in older people starting primarily in their 50s, 60s, and 70s. The HPV associated cancers, again, not related to smoking and drinking, actually happen in younger individuals, and we see them a lot in patients in their 40s and even younger. And so it isn't just sort of kind of one cohort, and it really depends on what the driver of the head and neck cancer is.
Is there an especially long lag time between exposure, whether it's to this virus or tobacco or alcohol or maybe some workplace things and the development of a tumor?
Yes, you've got it. So whether it's from viral exposure or smoking, the lag time, if you will, is typically measured on decades and not just a few years at a time. And so these are exposures that have been in smoking, example, that have been going on for decades, and people can have stopped smoking and yet still be at risk. And certainly with HPV infection, it happens earlier in life, and then we see it decades later as well.
When you're performing surgery on somebody who unfortunately has this, how important is it? What do you see in your practice every week in terms of somebody who was able to catch it early as opposed to late?
So catching it early is just critical for so many different cancers, and it's also true for head and neck cancer. And so for many of our cancers, the earlier the stage, the better the outcome and the better the survival. And so early detection is key. Even for cancers like HPV-associated tumors that have actually very good prognosis, catching it early can be important too from a quality of life standpoint. And so the amount of treatment that you need from both a surgical and non-surgical standpoint can certainly be impacted and can affect your quality of life. And so it's really important to catch it early. I should mention that not all cancers of the head and neck do we treat with surgery. And so non-surgical treatment typically would involve radiation, and sometimes radiation and chemotherapy.
How's the whole universe of treatments evolving?
So we, particularly with HPV-associated cancers, where we know the cure rates are really outstanding. They're quite well for non-smokers. It's very important as part of our discussion and our decision-making to focus on function and quality of life. And so a lot of what we try to do is more minimally invasive surgery, de-intensification of treatment such as radiation and chemotherapy, with the long-term goal that will be translated and improve function and quality of life after treatment. And so that folks are really able to do all the things that they're passionate about and do it quite well without much of a drop-off.
Sometimes I didn't have enough dental cleanings during the pandemic, but now that everybody's getting back into regular dental maintenance, I remember some dentists at the end of just coming to check you out after cleaning would run their fingers like around your tongue. Is this what they're looking for?
For sure. And so a comprehensive head neck exam during a dental procedure is really part of best practices. And so what they're looking for are sores or sore spots in the mouth and throat that don't heal, masses in the mouth and throat, enlarged lymph nodes in the neck. And so that's what they're feeling for. And honestly, Jeff, I really try to inform all my patients during each visit how to be able to provide surveillance for themselves, such that if they notice any of these findings, they know to contact me before their next visit, because as we discussed earlier detection is paramount.
So particularly if somebody has been a smoker, maybe used chewing tobacco, we haven't talked about that, used to drink a lot, they should be on the lookout for any change back there and not brush it off.
Exactly. So just a couple things. A sore or ulcer that doesn't heal should be thought of suspiciously and should be checked out right away. An enlarged lymph node, whether tender or not, particularly non-tender, is something that should not be ignored. Very often I see patients who are on multiple rounds of antibiotics for an enlarged lymph node, but they may have risk factors that we described earlier from a smoking standpoint and or HPV association and age cohort. And those are individuals who should be seen by an otolaryngologist or their primary care physician, who can refer them to the appropriate individual.
What are some of the other risk factors? Does this affect any different demographic groups, ethnic groups beyond age?
So great question. And so We discussed already smoking and drinking in excess, and so I won't belabor that. We also talked about HPV infection, and so that's important as well. There are other exposures. For example, woodworkers and metal workers can not commonly, but be at risk for head and neck cancer as well. And so these are some of the cohorts that we need to think about and educate when providers even are looking out for head and neck cancer or what might be early signs of head and neck cancer.
All right, so the big takeaway for viewers here, if you feel something funny, you see something funny, don't wait on that, and maybe talk about the HPV vaccine again and the importance of people getting that at an age where, you know, they're not really worried about something that might happen 30 years later.
That's right. Early detection and screening is really important. You asked the question before, but the group that is at most risk, for example, in HPV associated, are white males. They are leading the charge in terms of the increased incidence. And to your point, with head and neck cancer, please, if you're not certain, just talk to your primary care doctor. Make sure you get to the right place. We talked about some of the early signs: enlarged lymph nodes, sores in your throat, and so forth. And that can be very important.
Dr. Rodney Taylor, University of Maryland Medical Center. Doctor, thanks so much for the time.
My pleasure, Jeff.
And that is Direct Connection for this week. Join us every week at this time for your chance to ask the experts. Please follow us on Twitter at MPT News. We're back Friday with State Circle. For all of us at MPT, thanks for watching and have a good night.
Your Health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.